Diarrhea is passage of 3 or more liquid stool per day or more frequent passage than normal for an individual. By classification, acute watery diarrhea is acute onset non-mucous blood non-mucous and non-bloody stool which lasts less than 14 days. Persistent diarrhea is which starts acutely watery and lasts more than 2 weeks. And chronic diarrhea is insidious onset and diarrhea lasting more than 14 days. Insidious and by the time of onset, diarrhea is acute, persistent, and chronic, and by etiology, it is osmotic, secretory, inflammatory, and motility related. How relevant this is to my practice? Chronic diarrhea in pediatric age group is one of the most common presentation in primary care setting. Globally, diarrhea is fifth leading cause of death in children under 5 years of age, and 50% of which is due to chronic diarrhea. Bacterial and parasitic infections are common cause in tropical countries, whereas inflammatory bowel disease is more common in Western countries. It can be diagnosed clinically and by specific laboratory investigations, and management is done according to the cause with rebuilding nutritional recovery. The causes of persistent or chronic diarrhea by age group, if it is less than 6 months, the non-systemic symptoms is prolonged bacterial gastroenteritis, prolonged enteritis syndrome, parasitic infection, food protein allergy, medication use, chronic constipation, and Hirschsprung disease. And if it is more than 6 months, prolonged bacterial gastroenteritis, post-enteritic syndrome, parasitic infection, celiac disease, medication overuse, inflammatory bowel disease, and some type of functional diarrhea like toddler diarrhea and irritable bowel syndrome. And symptom in infants and young children, the etiologies are infectious etiology by parasite infection, appendiceal abscess. By malabsorption, it is post-infectious lactase deficiency, food protein intolerance, toddler's diarrhea, cystic fibrosis, celiac disease. In inflammatory conditions like SCID and HIV enteropathy, endocrine causes like adrenal insufficiency, and other causes like lymphangiectasis, toxins, and rare congenital bowel disorder. The uncommon causes
পানি লিখে দেওয়াটা আর পড়াটা আমরা বুঝতে পারি, যেটা বাকি পড়াটার মধ্যে কারণটা থাকে এগুলো তো তোকে আলাদা করে মনে রাখবে। আমি যখন পড়ি আমি কি করি থাকবে সেগুলোকে আর কিছু করি না। এই ক্লাসটাকে আগে লাগে সবাই আবার ওটাকে আগে বলতে বলে দেবে না।
In older children, the etiologies are in infectious etiology, it is parasitic infection, appendiceal abscess, in malabsorption, lactose intolerance, laxative overuse, celiac disease, and secretory neoplasm. In inflammatory conditions like eosinophilic gastroenteritis, irritable bowel syndrome. In immunodeficiency, HIV enteropathy, endocrine cause like adrenal insufficiency, hyperparathyroidism, and hypoparathyroidism. And other causes like enteropresis, constipation, irritable bowel syndrome, and toxins. This is the mechanism of secretory diarrhea. This is pathology is usually in the ion channels, ion transport channel in the intestinal lumen, which becomes overactive and secretes excessive water and electrolyte, which causes secretory diarrhea. This type of diarrhea persists even during fasting, and the positive agents usually cholera, E. coli, carcinoid, neuroblastoma, congenital chloride diarrhea, Clostridium difficile, and cryptosporidiosis in case of HIV infection. And in osmotic diarrhea, these are due to indigestible substance which the indigestible substance reaches the colon and absorbs more osmotic substance, absorbs more water and increases the volume of stool and causes diarrhea. The causative agents are usually lactase deficiency, glucose galactose malabsorption, lactulose, and laxative overuse. The clinical feature is this type of diarrhea stops with fasting, and there is increased breath hydrogen with carbohydrate malabsorption and no leukocyte in stool. Diarrhea due to increased motility, the pathology is usually hyperactive bowels, and this causes reduced gastric transit time and food is not digested and rapidly excreted. The causative agent is irritable bowel syndrome, thyrotoxicosis, and post-vagotomy dumping syndrome. Infection can also contribute to this type of diarrhea. Due to decreased motility, defect in the neuromuscular unit, which causes stasis of the content of the colon and which causes bacterial overgrowth, and that indirectly causes the diarrhea. The causative agent is pseudo obstruction, blind loom, Hirschsprung disease, and the clinical features are due to bacterial overgrowth. Diarrhea due to decreased surface area is due to reduced functional capacity. These are usually short bowel syndrome, celiac disease, and rotaviral enteritis. This might need elemental diet and parenteral alimentation. Diarrhea due to mucosal infection, these are causative agents Salmonella, Xylella, Amoebiasis, Yersinia, and Campylobacter, which causes inflammation of the gut mucosa and decreases colonic reabsorption and also causes increased motility. This usually causes dysentery with blood and mucus and WBC in stool. the clinical presentation on history is very important about finding the causes. We should find fever, blood or mucus in the stool, and exposure to any farm animals and reptiles to rule out Salmonella E. coli for hemolytic uremic syndrome, and any suspicious food, recent travel, or any antibiotic overuse in recent days. When diarrhea is caused by virus, it is usually last more than 7 to 10 days, watery diarrhea with vomiting, and some children may have upper GI syndrome. But when it is caused by bacteria, it causes high fever, blood in the stool, abdominal pain, and Shigella infection is maybe also associated with seizures. In physical examination, we should check the dehydration status of the child, and if there is tachycardia and blood pressure, and some signs due to consciousness level, fever. On abdominal examination, if there is any organomegaly, rebound tenderness, guarding rigidity present or not. Also, perineal inspection should be done, because in Crohn's disease there may be special some tag or fissures may be seen in perianal region, and some in cases of Yersinia infection, arthritis and rash and pseudoappendicitis may be found. What are the red flag signs in case of in this child? If the child is less than 3 months and worsening of diarrhea is present, blood, mucus or steatorrhea is present in the stool, and signs of symptoms of moderate to severe dehydration is present, and failure to oral rehydration is also danger sign, and high risk children which who have concomitant comorbidity due to prematurity or inflammatory bowel disease. If there is any systemic symptoms or associated symptoms like oral ulcer, joint pain, rash, perianal disease, subacute and chronic diarrhea lasting more than 2 weeks. Rome 3 criteria for functional diarrhea in neonates and toddlers. This is usually found, it is usually seen daily painless and recurrent passage of more than 3 large and unformed stool. Symptoms usually last more than 4 weeks. Onset of symptoms that begins between 6 months to 36 months of age, and passage of stool during waking hours, and there is no failure to thrive if calorie intake is adequate. What investigation should be done? Routine blood investigation should be done with CBC, CRP and ESR, and renal panel, and electrolyte should be done. Stool examination for ovocyst, parasite and leukocyte count, and some cases if required we may proceed for culture. These are some special tests for some special cases for chronic diarrhea. In celiac disease screening, anti-transglutaminase antibody, anti-endomysial antibody, and serum IgA level, followed by confirmatory diagnosis of intestinal biopsy. For pancreatic exocrine function testing, amylase lipase and fecal elastase test should be done. For some food protein allergy, skin prick or skin patch test may be done. And fecal calprotectin also indicates an inflammatory intestinal process. Fecal occult blood test and endoscopy and biopsy is more confirmatory and more specific to some diseases. For principle of management, first principle is oral rehydration. Unless there is any surgical abdomen or patient is taking orally, oral rehydration is the best process. Breastfeeding should be continued. Plain water should be avoided in babies less than 6 months of age, and encourage the children to eat. And commercial carbonated waters, beverages and fruit juices should be avoided because that may cause osmotic diarrhea. In pharmacological agents, probiotics may be used. For anti-secretory agents like Resicatrotil usually may be used, and zinc supplementation may be done. And for prevention of infection, bottle hygiene should be maintained. Caregiver hand wash should be done properly. Rotavirus vaccination is beneficial, and changing to lactose-free milk or soy milk formula for several days is also beneficial. And we should also identify the infection and treat with proper antimicrobial and antifungal if there is specific indication and diagnosis confirmed. And antifungal should be done started if the fungal infection is also suspected, with supportive blood investigation like CBC, CRP, LFT, electrolytes, and stool routine examination may be also beneficial. These are type A and type B diet for chronic diarrhea. Type A diet is mixed, made with puffed rice, ground and mixed with sugar and oil, and then boiled water is added to it to make a thick well, and this can be used within 3 hours. And type B diet, egg white is added to the mixture of some specific weighted rice, sugar and oil, and then boiled water is added to make it a thick well, waiting for 100 grams. These are the diseases which have clinical relevance with chronic diarrhea, like Hirschsprung disease, which is associated with systemic toxicity, toxic colitis, and inflammation. Appendicitis also causes right iliac fossa pain, fever, and also persists with vomiting and diarrhea. In cystic fibrosis with respiratory symptom, there is also GI system and there is persistent diarrhea. And celiac disease causes recurrent diarrhea. Irritable bowel syndrome has no organic cause, and it is characterized by irregular bowel habit, abdominal pain, and GI system. And Crohn's disease is also immune-mediated disease that causes chronic diarrhea. This is chronic non-specific diarrhea or toddler diarrhea. It is usually occurs between 1 to 3 years of age of child, and passage of non-bloody stool, which gets looser as the day progresses. Undigested vegetable matter is still in the stool, and the child has normal weight gain and normal diet. Though irritable bowel syndrome is more common in this age group, and treatment is reassurance, elimination of juice, and a highly osmolar food diet like fruit juice, popsicle candy, etc., and usually resolves by 3 to 4 years of age. Diarrhea in case of pancreatic insufficiency due to fat malabsorption, which causes greasy and foul-smelling stool, and more common in cystic fibrosis. It is maybe screened in newborn, and sweat test screening is done for cystic fibrosis. Evaluation is done by fecal fat estimation and stool elastase. Treatment is pancreatic enzyme replacement. In celiac disease, presentation is variable, and evaluation is done by serologists like tissue transglutaminase and serum IgA level, and confirmation is done by upper GI endoscopy biopsy. Treatment is gluten-free diet, and there is concern is more about the adherence to the specific diet, and there is nutritional deficiency, growth and pubertal delay, and bone health also. In irritable bowel syndrome, there is symptom of abdominal pain and changes in bowel habit. It is a diagnosis of exclusion, and positive family history is frequently seen, and there is there is also psychological stress factor in these cases. Treatment is cognitive behavioral therapy, antispasmodics, antidepressant like amitriptyline, and avoid trigger foods which can cause uh, different different patients. ইম্পর্টেন্ট গুলো পড়েছি ইনফ্লামেটরি বাইল হ্যাঁ and inflammatory bowel disease, the general characteristic is weight loss, abdominal pain, and diarrhea. There is perianal fissures and tag. Positive family history is found. In laboratory investigation, we usually find anemia, hypoalbuminemia, elevated CRP and ESR. Evaluation is done by upper GI endoscopy and colonoscopy, and MRI and can be also done. Treatment is anti-inflammatory medication, immunosuppression, biologics, and surgery. As chronic diarrhea causes nutritional deficiency, there should be this multivitamin, iron, folic acid, vitamin A, potassium, and magnesium sulfate, elemental zinc, and vitamin D supplementation should be done to recover the child with nutritional deficiency. A type of diet is green banana diet, which is used in the chronic diarrhea, and this amylase resistant starch present, which is non-digestible and reaches the colon and small intestine, which has trophic effect in colon and increase the absorption of salt and water. Care of child's perineum should be also done, as it causes perineal irritation, perianal irritation, and there is erythema excoriation may be seen surrounding the area of anus, and diarrhea. The care should be given with frequent changes in diaper, and there wiping motion and should be avoided in these cases. The best is to gentle wash with soap and water and pat dry or air dry, and barrier cream can be used for the skin care of the perianal region.
chronic diarrhea